We even saw a case where one very large African-American mutual aid society built their own hospital using member dues and such. So during this period, we're seeing all these different experiments with how do we make medicine more accessible, right? How do we figure this out? It's always been important, but now people are really captured by medicine. It's modern medicine, and surgery is advancing, and they're figuring out antibiotics and penicillin, and people are getting just very, very excited about medicine. So of course, now they want to avail themselves of these new treatments, even, new, clean, more modern hospitals and such. But the problem is, of course, the prices are rising. And with healthcare, the difficulty of healthcare is it's very hard to budget for, right? When you're looking at hospital costs and stuff, right? You might not have much healthcare bills this year, but next year somebody goes in the hospital and they skyrocket. That's very difficult for a family to budget. And so of course people want to find insurance mechanisms, or what they would often call prepaid plans, which was just a synonym for insurance at the time. So that's why I'm mentioning there were all these different experiments. Like I mentioned, the fraternal orders and the mutual aid societies and the union welfare funds. I'm going to mention one by the physicians, because I think this would have probably been the dominant model if the AMA had allowed it to live, which it did not. And it's interesting too, because it shows physicians fighting against the AMA, basically. They were called prepaid physician groups or prepaid doctor groups. And this is just, physicians came up with this on their own. It was just a natural way to practice medicine. If you think about it, they were physician groups, which of course we have today, but today in the United States, our physician groups are single specialty. These physician groups were multi-specialty, which solves the problem that we have today of fragmented care. This way they had integrated care, right? Think of one-stop shopping, all your different physicians that you might need in one spot, right? So you could have these, being early in the 20th century, they would have had, say, surgeons, obstetricians, pediatricians, general practitioners. You might have some ophthalmologists, but you have all the different types of medical practitioners there. And this is really important for people, not for young and healthy people, but for people who are chronically ill, who are older, maybe have a number of conditions, have a difficult to diagnose condition, because that's where you need sometimes more than one practitioner from a different discipline and a different specialty, kind of looking at the patient and trying to figure out what is going on. And that's what they would actually do in these practices. At the end of the day, they would sit around the table and where are the difficult cases that we can't figure out? Let's talk about it. Much more exciting way to practice medicine. You talk to physicians today, if you're single specialty, you're in your whatever procedure it is you're doing, you're just doing it over and over and over again. It gets to be very dry. But if you're practicing in a way that you're learning from your colleagues across specialties, across disciplines, and your problem solving, that's just much more, things are a little bit more different. It's a little bit more novel, creative. That's more of the art, right? Where you see the art of medicine and not just the science. So it was a great way to practice medicine. It delivered high quality care because of the fact that the physician group owned, so to speak, the health of that patient. They were responsible for it. The unfortunate thing with fragmented care today is if somebody's very sick or has an illness that's difficult to diagnose, they just get sent from one physician to another. Okay, we did all the tests we could. Now you need to go to the next specialist. Okay, we did all the tests that we can charge the insurer for. Now you need to go to the next specialist. And, you might die in between one specialist and another. That information isn't even ever going to get fed back into the system. None of the physicians who saw you are even going to know. It's, supposedly general practitioners manage our total health profiles and everything that we have going on with a number of specialists, but how could they possibly, that's impossible for them to do with the amount of time they have in a day. They can't be on the phone consulting with a number of different specialists for all their patients. It's just, they can't. They do sometimes, but it's very limited. It's not what people want it to be at all. So this is a big problem we have. Nobody, if you're really sick and there's something wrong with you, there's nobody who really has to find out, right? And there's no even economic incentive for there to be, unless you can just get the money together to go to one of these really, great, like say the Mayo Clinics or the Cleveland Clinic or something like that. So the prepaid physician groups solve the problem that we have today of fragmented care by providing holistic integrated care. The other thing that the prepaid physician groups did that was so elegant was kept costs in control. And that is because the way they were set up is basically the physician acted as their own insurer. Instead of having an insurance company involved, right? The physicians themselves, the physician group itself insured itself. So the patients, the way it worked is patients, there was an individual rate and then like a family rate, just like there is today with insurance in the United States. But instead of you sending your payment to an insurance company, some corporation far, far away, probably in New Jersey, instead of you doing that, or Connecticut, or New York, you would send it to the local physician group. And this was really important because of the way it incentivized physicians. It incentivized them, if they really just didn't care at all about people and only cared about making money, it is in their best interest to keep you healthy, because that means they don't have to spend their resources. So today you hear people who complain about rationed care and care being withheld. And that is a problem when the provider of care is not incentivized, on the back end to make sure that you're healthy, right? If there's no other balancing act on that, then that can be problematic. But in this case, it was balanced perfectly because it didn't make sense for them to try to kind of unneedlessly withhold care. Because first of all, you're going to lose money because people are going to say it's not worth it to go to that prepaid physician group. I'm thinking of let's think of a modern day example. I've had headaches for 2 years and they won't give me an MRI, right? So that's the worst publicity. It's the last thing you want. And also it would also be shooting them their own selves in their foot if they were just needlessly withholding care, because then if you do get sick, you're going to end up costing that physician group more money down the road. So it's better just to find out, and also to keep you healthy and to make sure you're eating properly, right? If you're diabetic, they're going to be very concerned about making sure you understand nutrition and that you're eating well and you're exercising. You see, now the physicians are starting to be incentivized a little bit more than just tossing advice at you, but that to really actually care. And hey, maybe we should bring in a nutritionist. Maybe we should have a class once every week, and maybe all these other things that we could imagine would happen if they were incentivized properly. So at any rate, they were incentivized to keep their patients healthy, not ration care, but also not needlessly over provide care. That's a problem we have today in the United States, is that people with insurance, physicians and hospitals sometimes try to run up the bill. I'm not saying there's anything particularly wrong or bad with physicians. They act like human beings. They act like professors would and journalists would and such. They act according to how they're incentivized. Some of the reasoning they might tell themselves is, I have to run up this bill to make up for my Medicaid patient, maybe. Or they might say, I need to run up this bill because I can't get reimbursed for this other thing. Or this is gold standard treatment. I'm throwing all these tests and procedures at the person. That's what I'd want from my family member. That's the kind of reasoning we would all go through in order to act along the lines with our incentives, right? These prepaid physician groups had no incentive to needlessly provide procedures, because obviously, again, they would just be taking money out of their own back pocket. This is really important. If you look at healthcare systems around the world, I would say one of the key problems we have is how are the providers incentivized. I think we sometimes focus a little too much on the patients and stuff. To me, it's the providers, the one with the expertise, right? They're the ones with the requisite expert. When you're saying, I want you to walk a tightrope between overutilization and rationing care, well, who's going to have the expertise to make that decision? It's going to be, the physician, the nurse practitioner, the hospital practitioner, whoever it is providing care. And yes, they're going to be doing that, getting input from the patient and such, but that's really where we need to have the incentives lined up correctly. And so that's why these prepaid physician groups were so brilliant. Progressives loved them. This is what, for a very long time, until the late 40s, early 50s, this was the model that if we had universal health care in the United States, this is what the progressives and the reformers, even in the Social Security Administration under Truman, this is the type of model they were pushing for. Progressives loved it. Consumers loved these prepaid physician groups. There were hundreds and hundreds of them around the country.